Well, good afternoon. It's a pleasure to see you all, and hope that we can share some new information with you and help you see where we are in things. I want to just start by reminding folks that we're just 1 week into this. To some extent, it feels like it's been a lot longer than a week, but it really is just the first week, and that's important as we get to the issues of what's going to happen in the future. I also want to start recognizing that more and more communities are being affected, and more people are being directly impacted by the H1N1 novel virus that we're seeing this year, and that can be certainly difficult for people, and we hope that with our information and answering the questions that you have, we can ease that challenge. The latest cases that we release every day at 11, today's count is 141 confirmed cases, and 19 states have confirmed disease. That's up 8 states since yesterday's report, and our website, www.cdc.gov, lists the individual states and the case counts that have been confirmed in all those individual states. We have, as you know, we previously made the decision to ship 1/4 of the antiviral assets in the Strategic National Stockpile to the states and project areas. We are well on the way to getting those antivirals out to the affected and unaffected states. And the Secretary of Health and Human Services, our new Secretary, Sebelius, made the decision to purchase 13 million more courses of antiviral drugs, essentially to replenish our antiviral strategic national stockpile. We don't know whether we're going to need those or not, but we wanted to be ready. We also have, since the last 24 hours, have been able to ship antiviral drugs to Mexico through the request of the Mexican government and approval to help the Mexicans. We're shipping 400,000 regimens of antivirals to Mexico, and really hope that that can help them as they're coping with the illness in many parts of that country. In the last 24 hours, we've issued 2 new MMWR reports. One describes the story in a school in New York City, and the other describes information from the Mexico outbreak itself. It's really heartening to me that we've been able to get that kind of information out with the partnership of the Mexican authorities and the New York City Health Department to make sure that people can see the experiences in those 2 areas and learn from them as we go forward. You may have seen that Harvard released a public opinion poll today. If you didn't see that, I think we can probably point you to their press release information. And there's some real interesting findings in what they reported that I'll be mentioning. 2 that I want to say I think I need to thank all of you about, but one of their findings is that apparently 75% of people report that they are following this, they're paying attention, and I think you're part of the reason for that, so thanks for all the help that you've been with that. And the other heartening news was that 59% of those polled said that they are washing their hands more often or using alcohol-based hand gels more often. So that's amazing, and that's great, and that will reduce other respiratory infections as well as help reduce the transmission of this virus. So we think this is a really good result of how the American people are reacting to this challenge. There's been a lot of discussion in the past couple days about vaccines. You may have known I did a couple hearings in Washington yesterday, and I think half of the questions were about vaccines. This is the right time to be talking about vaccines. As you know from our seasonal influenza experience, we have to plan for vaccine a long time before we intend to use it. And so we're lucky today that Dr. Nancy Cox will be speaking with you in a little more technical detail about some of the virus characteristics and the vaccine issues. But just in general, what I want to say is that our CDC experts are preparing this vaccine seed strain. That's the first step, trying to identify a strain that is going to be the right strain in terms of the immunologic or antigenic characteristics, but also one that will grow well and that the manufacturers could really handle. After that, there are steps involved with pilot lot production and clinical testing and dosage formulation and such to figure out if you're going to make one, how would you do it? And then after that, there are additional steps in terms of making the vaccine. There are also several steps in terms of decisions, and I'm not sure if Dr. Cox is going to go into that, but I want you to know that what we've done so far is that aggressive, make sure that if we need to make a vaccine, we can. We haven't made the decision yet we will manufacture large numbers of doses of vaccine, and we haven't made the decision yet that we will use a vaccine if we produce a lot of it. Those are decisions that need to be done in a deliberative, careful, thoughtful way. They're not CDC's decisions. There's a number of entities that contribute to that, and it's really scientific expertise that helps with those types of decisions. So when we talk about vaccine, it's the right time because we won't have one if we're not talking about it now, but there are a lot of things in the future that will be needed. So I think I'm going to let Dr. Cox talk a little bit about what we've learned about the virus and where we're going with this whole idea of vaccination.
Thank you, Dr. Schuckett. We've actually learned a great deal about the viruses that are causing these infections. And we're doing this with the international community. So as you know, the virus has been detected, this novel H1N1 virus has been detected in a number of countries internationally. We're all working together to characterize the viruses that have been isolated from the individuals. Now, the good news is that all of the genes of all of the viruses that we have examined to date are 99 to 100% identical. What this means for us is that it will be somewhat easier to produce an influenza vaccine. The first step in developing a vaccine is to derive what we call a candidate vaccine virus that will grow well enough for vaccine manufacturers to produce large numbers of doses. And we call this candidate vaccine virus a high growth virus, indicating that it will be able to be produced in large enough quantities. So we've already grown the viruses from patients in eggs, and we are distributing the viruses to our global and domestic partners who use traditional methods called reassortment to make high-yield candidate vaccine viruses. Now, what reassortment means is that the new H1N1 virus is co-infected in eggs with a virus that already grows well in eggs. And we use certain laboratory techniques to derive a virus that has the internal backbone genes from the laboratory strain that grows really well and has the antigens, the surface proteins from the new virus. And this is what the vaccine manufacturers use to grow the vaccine. We are also using more modern molecular genetics techniques called reverse genetics. And if there are questions about these techniques, I can answer them during the question and answer session. Now, we estimate that it will take about 3 weeks to create a high-yield vaccine candidate virus. We've already started that process in our laboratory. That process is going quite well. And so if the virus cooperates and grows well, we will soon be able to distribute a candidate vaccine virus to the manufacturers. The companies then need about 8 to 10 weeks to make small lots of vaccine to test to see whether they can actually ramp up and produce large amounts of vaccine, and to produce pilot lots, which then can be tested to see what actual doses of the vaccine will be required to induce good levels of antibody in humans. I think I'll close there.